welcome. Happy New Year. I'm Dr. Maneevese, one of the interventional radiologists here at Alate Health. Welcome to Alate Health Presents. Joining me today is Dr. Andrew Doe.
And Happy New Year to you as well. So, new year, new things. What are we going to talk about today?
Well, before we move to anything new, let's talk about the newest, most exciting thing. Our new location is officially up and running.
Yes, we opened just before Christmas, but now we're up and running. Hopefully, we'll be up to 5 days a week. We're currently at 2 days, and that's at 12825 Gulf Freeway, down in the Pearland area. And we're seeing all patients, whether it be enlarged prostates, fibroids in your uterus, vein disease, disease in the arteries, can't walk, all that stuff. We're open and we're full service down there.
Super, super exciting. So it's basically like the original Alate Health, except closer to you if you live out in that area.
Absolutely. We had, a lot of patients that came from the area that were referred to us. So we looked at this as kind of the best area to expand the practice to, since we already had a presence or a patient following there.
Just another way Alate Health is serving the greater Houston community. So I bet, Dr. Doe, it's been pretty stressful the last few weeks. You've had a lot on your plate. Just for our viewers to get to know us a little better, what are some ways that you relieve stress? Extracurricular activities? Is there something that you do to blow off steam? What was your go-to during these last few months?
So my favorite thing is to be active. I love to exercise, whether it be lifting weights, doing cardio exercises, and my passion, my hobby is Brazilian Jiu-Jitsu. I've been doing that for, it'll be 23 years this August. So I'm really passionate about that. I love to do it. I love to learn it. I love to teach it. So that's really kind of, my thing. And how about you? What hobbies do you have?
So I do yoga. Quick Instagram search will reveal that answer very quickly. I think yoga is a really good combination of being able to be active and move your body, and then also work on keeping a calm mind. So all of that really comes to play, especially when we do our procedures. They can get pretty complicated at times. Especially the prostates. So being able to have laser focus and stay calm the entire time is really important.
Yes, and I think the other thing that's very important, especially when we have these high stress professions, is to find balance in your life. Stress releases all these hormones, which are bad for your blood vessels, bad for your appetite, bad for everything. And I think it's very important that you find some balance, something you can do to let off steam and relax yourself.
So I'm curious, when you're in a case, Dr. Doe, and you find that it is more complex than we anticipated, do you give yourself a pep talk? Well, what do you do to get through that?
I start, first of all, with a deep breath. And then I ask myself, what have I tried? What's left to try? So I kind of go through my toolbox and try to think of either something that I have done in the past that I haven't tried yet, or I think of applying something I've already done in a different way.
Okay. And, for our audience out there, just so you know, watching him from the outside, you can't even tell that, he's stressing out or he's thinking about it, he's going through his toolbox in any way, shape, or form. He is cool as a cucumber the entire time.
I think that's probably the most important thing, is to remain calm.
Mm-hmm.
I think once you get frustrated, once you get upset, once you get worried or whatever it may be, I think you lose focus. And
Absolutely.
I think your patient care can't be as good as it is if you don't have 100% focus.
Absolutely. And it's really important in interventional radiology. In our last episode, we talked about how, in our training, we do trauma and all of that. So it's really important to just try to stay level-headed the entire time. And there's a reason that the meme exists, keep calm and call interventional radiology. There's a reason for that.
Yes, so our profession, especially in the hospital setting, we kind of become the gatekeepers. We're like the last resort. I've had patients ask me in the past when they see my lead, why do I have a skull and crossbones on it? And Actually, the real story is I got it at Halloween. That's why it's black and orange. But also because I thought it was fitting that, when the surgery doesn't go right and there's complications, you call interventional radiology. When the patient's doing something and you can't figure it out, it doesn't make any medical sense, you call interventional radiology. So we are kind of like the gatekeepers in that last stop, and usually we can figure it out and fix these patients.
Absolutely. We're always willing to try. That's the thing. We're always willing to at least give it a try. So whenever I get stuck, I also go through sort of your toolbox. I say to myself, what would Dr. Doe do next? And it does help to kind of change your environment. So sometimes if this is the heel of my shoe and this is my foot, I'll just kind of take my heel and put it on the heel of my shoe. It changes it up a little bit, refreshes how I feel in the environment, and sometimes that makes all the difference.
Absolutely. It's just, I think it's, a little Caesar Milan with training dogs, just kind of to break your focus on the one thing that isn't working and get you to start thinking about options and about things you can do. And I think that's what really separates the level of care that we can give at Alate Health from other places, because we have a lot of experience. We have excellent training. We can bounce ideas off each other, and because it's such a small closed setting, that we're always within reach of one another. And I think that's key versus being kind of stuck in the basement of the hospital, away from any help, any aid, any ideas.
Very true.
It turns out better for our patients.
I couldn't agree more. So in keeping with our work-life balance and staying healthy, kind of want to switch gears to vascular health. Talk a little bit about what that means and what that means when you're not keeping your vascular health in mind, and what the consequences of that could be. So just a few things that would be easy for us to do. What is vascular health? How do we maintain it? What are things that we can do to make sure that we're in tip-top shape in regards to vascular health?
So before you even get into supplements or vitamins or medications or things like that, I always use the KISS theory: keep it simple, stupid. And the best thing you can do for your vascular health, your vascular system is meant to have blood moving through it. Movement is the key. Bad things don't happen to patients that are active. And I tell all my patients this, my oldest patients are my walkers. Patients who walk, and I don't mean from the chair to the fridge. I mean patients who get out and they walk around the block, they walk around the neighborhood, they walk the dog, they go in the yard and they find yard work to do, and they're always moving. They're active patients. It's not the weightlifters or the runners or the jiu-jitsu guys. It's patients that walk and patients that maintain a healthy activity level. And that's because the blood needs to move. When blood doesn't move, when you're not constantly at least giving a little stress to your heart so it has to work and become more efficient, then things kind of slow down and the rest of the body kind of slows down, and then it just cycles into badness and into disease.
And that's the last thing we want, is for any of this to slow down. Keep that momentum going. I think that's a big misconception when we say stay active. Our patients think, oh, we need to go to the gym, we need to take classes, we need to go for a run. It's not that, it's just getting up and moving.
Absolutely. And, I tell patients that have difficulty walking, I say, listen, go out and go around the block one time and do that for this week. And then next week, go around 2 times. Very slowly build it up. Like you said, you don't need to go to the gym. You don't need to get on the treadmill and sweat like, there's no tomorrow. You just need to get moving and get active. One of the great things that insurance companies have finally caught on to is some of them will give patients either a watch or another band that will count steps and kind of gauge their activity. If they can hit certain goals, then they'll get a rebate on their insurance. And I think that this is a great step forward for medicine. Stay away from all the medications and all of these things and crazy lifestyle adjustments and just simply move.
What a great tidbit to add to that. That's a great advice, Dr. Doe. Okay, so we're going to take a quick break here. When we come back, we're going to talk a little more about vascular health and ways to optimize your health for this new year. Stay tuned.
Light up your new year with a top-rated luxury SUV from Ron Carter Cadillac. Drive the new 2021 XT4 Luxury Collection for $319 a month, the new 2021 XT5 Luxury Collection for $399 a month, or the new 2021 XT6 Luxury Collection for $459 a month. All for 39 months lease with just $1 down. Gulf Freeway, just 2 minutes south of the Beltway.
Shop smarter when you shop Ron Carter. RonCarterCadillac.com.
When it comes to protecting yourself and your partners, all the information out there can be overwhelming. Visit our website. We are a free and confidential service striving to help you stay informed and stay notified. We are committed to a healthy Houston.
Amazing things for you.
And welcome back to another episode of Alate Health Presents. This is part 2 of our first episode of 2021. And we were talking before we left about kind of using the new year and that theme of New Year's resolutions for self-improvement and to change your lifestyle, not radical changes, but small changes such as simple things like getting out and being more active, walking more. Now, Dr. Maneevese, how do you gauge your activity?
So it's hard, right? Because sometimes we get so caught up in our work that we can find ourselves sitting in one place and not moving for hours. So I've got an Apple Watch that tells me if I've been sedentary for 15 minutes out of the hour. So when it hits the 15 minutes, it'll give me a little nudge and say, oh, it's time to get up because you haven't moved in 50 minutes. And it's actually really surprising when that happens because I'll be so lost in my work that I'll realize, oh, I have been sitting for 15 minutes. Okay, so I'll get up, just pace a little bit, and then I'll sit back down and finish my work.
Excellent. And this is actually something we tell our vein patients that after their procedures, get up and walk 10 minutes of every hour. And I've actually had patients in the past, such great patients, that were getting up at night and walking those 10 minutes. So if you do ever need treatment and you get treatment, you don't need to get up during the night. Myself, I use another smartwatch, and it will count my steps. I don't have activity reminders because fortunately I don't really need them because I notice if I get irritable, it's because I haven't moved. And I also use another device which kind of calculates not really steps, but how much strain I've put on my heart for the day. So I know if I get towards the end of the day and the number's really low, I got to do something. Fortunately, I typically get up very early in the morning and like to get that, done ahead of time. It's called a WHOOP, W-H-O-O-P, and you can form teams, which is great, especially for someone like me, for people that are competitive. You get on these teams and you see everybody else's number going up, so you want your number to go up. So it kind of promotes more activity and a healthier lifestyle.
And it's super cool. So you have the spectrum here. You have me that's sitting for hours on end. So I'll get up like once every hour. And then you've got Dr. Doe, who you try to get him to sit still. That's a feat in and of itself. So Dr. Doe, in addition to increasing our activity this year, what else can we do? Is there foods we can eat, supplements we can take that would help our vascular health?
Yes. So starting off with diet, and even in this day and age of medicine, when we seem to have these great advances, we still don't understand exactly how diet affects us. We're starting to gain some knowledge, but I think As far as that goes, I think it actually lags behind what we know about treating diseases. And hopefully that will continue to improve. But when we look at diet, number one thing is water intake. If you think about your blood as a fluid that if it doesn't have enough water, it can dry out and become solid. But if you have enough water, then it can, flow nice and normally and prevent these disease states, these vascular disease states from occurring. So have adequate water intake, 8-ounce glasses a day. For most people, you can't drink too much water. You can drink it too fast, but you can't drink too much water, and that will kind of keep you in balance and kind of keep everything working properly. Food, like I said, we're just starting to understand diet. If we look at diet in the whole, if we look at Asian societies, they have lots of stomach cancer, but no colon cancer. It's because they eat a lot more fiber. But they don't drink milk, so they don't get what's called a conjugated linoleic acid, which is protective of the stomach, which Western societies drink lots of milk, and that protects the stomach from stomach cancer. But we don't have a lot of fiber, so we get colon cancer. So what I tell people to do, just like your stock portfolio, be very diverse, don't eat too much of any one thing, and try to eat things in as natural state as possible. Not a lot of breads that are processed and things like that. A Twinkie isn't a bread.
Oh, well, learned something new. I was today years old when I learned Twinkie is not a bread.
So instead of a Twinkie, have yourself some 100% whole wheat. And this is kind of a disservice that these corporations do for the public. They tell you this is whole grain, this is organic and all the thing, and it doesn't mean anything unless it says 100% whole wheat or rye or pumpernickel. It's really not a healthy alternative to those things. So make sure you look at that and you figure out what's really going to give you a healthy diet.
Okay, so on the flip side of that, if one decided not to take these wonderful tips that you're giving us, what could be the results if you were to have poor vascular health?
So poor vascular health, comes with there's kind of a collection of diseases, and it's pretty rare that you don't have a couple of these things going on. And typically, the patients we see with poor vascular health kind of go into two categories. The patients that are overweight and have high blood pressure and diabetes. And, in diabetes, the blood is just full of sugar, and the sugar gets deposited all over the place. And I tell patients this all the time, that it's easier for your body to make fat out of sugar than it is to make fat out of fat. And that's just the way the body works. So that's one subset of patients. The other subset of patients may not be overweight, but they'll have high blood pressure, and especially smokers. Smoking, it needs to just go away for good, because as you well know, these are the hardest patients not only to treat, but to keep their vascular systems open and flowing properly. So smoking is really, really detrimental to your vascular health. And the reason is the muscles and the walls of the blood vessels, the nicotine causes those to contract. So if you have a little narrowing and now the whole vessel all the way around squeezes down, it magnifies it. So it makes a little problem that much worse. So, these are kind of our two subsets of patients with very bad vascular disease.
And so, as we've discussed before, interventional radiology can help with the opening of these blockages or opening of these stenoses, these areas that are too small for the blood to flow through. Once we open up these vessels, it's really up to the patient to keep them open. Is that right? Absolutely.
And in the past, I've had patients that had had a lot of difficulty walking. I had a patient tell me one time that he had to stop 12 times from the parking lot to the stadium to go to a Texans game. And he came in, we treated him, we opened him up, and he did great for a few months, but he continued to smoke. So he came back again. He said, well, it's only 6 times, but I'm just going back to where I was, and I don't want it to happen. So, if nothing we do happens in a vacuum, and the patient always has some responsibility to kind of change things to keep this improvement, kind of durable and keep these vessels open.
It really is a team effort here. Dr. Doe and I, we put our best foot forward, and we really do our best work in the suites when we're confronted with these difficult cases. But if it's not maintained with lifestyle changes and modifications, it makes our life infinitely more difficult. It may seem like it's not that big of a deal because our patients go to sleep and then in an hour they wake up and their legs are great again. But every time we have to intervene and every time we have to do the procedure again, it gets more and more difficult. So we don't want to run, the whole line and just at the very end say, I don't know if there's anything else we can do for you. So if we keep it as a team effort and everyone puts their best foot forward, I think that would lead to the best outcomes.
Absolutely. You get longer lasting results when patients are active within their own healthcare rather than seeking out, a quick fix. And, I tell patients if you want to get better, you can get better. But you got to put in some work. And, if you're not willing to do that, like you said, it's almost as if at Alate Health, it sounds cliche, we make it too easy. Patients come in, they see the same people, everybody's pleasant, they go in, they have their procedure, they fall asleep, they don't think anything happened, they wake up, they go and walk in the park and their leg feels great. So, the perception is that, I can just do that again. But if they don't put in their own effort, then.
So if any of our patients have leg pain, claudication, difficulty walking, cramping at night, restless legs, any of that, you can come see us in the Museum District or our brand new location
at 12825 Gulf Freeway in Pearland, 77024.
Okay, so we talked about activity, diet modification, foods you can eat. Now, what about just supplements? Is there anything you could take for vascular health?
Yes, there are a lot of talk about supplements that will, basically heal anything and everything, and a lot of them turn out to be snake oil. I tell my patients, a good multivitamin is great to have to make sure you're getting every element that you need. And the only other supplement that's really been shown to be very effective is coenzyme Q, coenzyme Q10. There's been a lot of talk about other things like resveratrol, which is what's found in red wine, but the jury's not out on that yet. So if you want to take something that's going to help your vascular health, and you're active and you're eating healthy, you can add in the coenzyme Q10, and that's probably about the only supplement that we really know at this point that definitely helps your vascular health.
Okay, so we really hit it from every angle. I think we're really setting ourselves and our patients up for success. In the future, there won't be any need to revascularize anymore.
That probably won't be the case.
We could still be optimistic. I'm the hopeful one. I'm the optimistic one. All right. So if one of our patients, if our patients are watching and they want to know how to reach us, Dr. Doe, how can they get into clinic and see one of us?
So they can always use the website, www.alatehealth.com, or our main number, 713-955-1707. And again, 2 locations, Pearland-ish, 12825 Gulf Freeway, and the Museum District office at 1213 Herman Drive.
That's all the time we have today. I feel like today was really short. We were having too much fun. So
Happy New Year.
Happy New Year. We will see you next time.